Okay, I'm about to give you one of the most boring lectures you're going to have in physical therapy school. So I'm going to try to make it quick, but I'm also going to try to make it interesting. And just know that what we're talking about with electrotherapy is I'm trying to give you all the vital information. Okay, you have your textbook to back you up on this, but I'm trying to give you the details that you need. Okay. All right, so electrical modalities, right? It's using some sort of electrical current, and we use it for three major things. We use it to try to make muscles contract, right? That's a motor response. We try to use it for sensory reasons. We're trying to change sensation in a reason, such as for controlling pain. And we might also use it for tissue healing. So some of the effects of electrical modalities can actually, some of them can deliver drugs, and some of them can also, just the electricity and the polarity of that electricity in the area can promote healing. So that's not really for the purpose of motor or sensory, but you might get some sort of sensation when your goal is tissue healing. So here's kind of like a breakdown. Doesn't have everything on it, but if you think about electrotherapy, there's three main reasons we use it, right? For pain, for tissue healing, and for muscle contraction, right? And within that, you have different types of electrical current. So for pain, we're going to talk about using TENS, transcutaneous electrical neuromuscular stimulation. And even within TENS, there's a couple different kinds. You can do acupuncture like, you can do conventional. You can also do something called interferential current. You can also do something called premodulated current, okay? There's lots of different options. For tissue healing, you can use something called iontophoresis. You can use high volt pulsed current, and you might use it for different reasons. You might use it for wound healing, or you might use it for edema, and you kind of set it up differently depending on why you're using it. And then for muscle contraction, a really common one, all muscle contraction is kind of called neuromuscular electrical stimulation, and you use it on innervated muscles. A really popular type is called the Russian protocol, but there's other ones too. And then there's another category, functional electrical stimulation, so we kind of infuse that into a functional activity. And there's even one more called electromuscular stimulation that you would use on somebody who has denervated muscle. So we'll get into we'll break these down today. So how does it work? How does electrical stimulation do what it's supposed to do, right? So there's a current. It depolarizes a nerve and produces an action potential. This happens in your body anyway, but we're doing it with some artificial source, right? An action potential is really just the messenger of the nervous system. Your nervous system's sending them out all the time. Now, if you get a current with enough amplitude that lasts for a long enough time, you get this action potential. And then if you get that right amount of amplitude, you turn up the amplitude enough, the amount of time can determine whether you're going to get a sensory or a motor response. And you're going to understand this when you do it in lab. All right, so there's different types of waveforms. All those names of electrical currents are typically describing the waveform, and it's just the shape. Like if you think about an XY axis, and above the x-axis here is positive and below is negative. That's kind of the shape of the waveform, and what it does is kind of described by what it looks like on the xy axis. So for instance, a direct current, which is pictured right here, it's continuous. It only flows in one direction. See, it's up here. It's only on the positive side. It's going to only stay positive. And it's a continuous flow of charged particles. Okay. So when we do direct current, it has a true negative and a true positive. So you'll need to know that later. You'll need to know what the negative and the positive leads are. An alternating current is probably one of the more common ones that you're going to see. And maybe some of you who have had E-stim, you've probably had alternating currents used on you. So it's continuous, right? Just like the direct current was continuous, it just flows and it never stops, right? Alternating current is also continuous. It just flows and it never stops, but it's bidirectional. It goes up into the positive and down in the negative and just keeps going back and forth. And this is a really common one for pain control, like interferential, premodulated. It's used in muscle contraction, different NMESs. And then another variation is called pulsed current. Pulsed current, it can be either one. It can be unidirectional, just one, either positive or negative, or it can be bidirectional where it flows, alternating currents. So it can be either of those, but it's not continuous, right? It's interrupted. It comes in little bursts, like little pulses. So it's pulses of current separated by periods of no current. So it's a very common option on many of your eSTEM applications. So you're going to see that come up as well. So that's what a waveform is, just describing the shape of the current. All right, here's pictures of them, right? So this first one is a direct current. It gets turned on, it goes up in the positive, it's continuous, it never varies, it's just at that level, and then it gets turned off, right? That's direct current. Alternating current is this nice like sine wave, up and down into the positive and negative. It's never interrupted, it's continuously flowing. Okay, and then over here on the right, you've got a couple different types of pulsed currents. But you see how there's a pulse, like you turn it on, turns off, and then there's a time where nothing's happening, and then it turns on, turns off, nothing's happening. So they're pulses. So this first one is called monophasic, meaning it only goes into one direction, right? Each one of these little things is called a phase, these little blips, and they're all positive. So it's monophasic, it's only going one direction. Versus down here, these are called biphasic. So this whole thing is considered a pulse or a phase, right? So it turns on, goes up in the positive, it goes down in the negative, then it turns off. Then there's a break, then it turns on, goes in the positive, goes in the negative, then there's a break. So those are examples of what they all look like. Those are what the waveforms look like. Just in case that's the way you need to be able to understand it, I like to give you some visual representation. All right, a lot of electrical terms that are going to come up. There are more than are on this list, but I'm trying to pull out the ones that you see on the machines, on the units that you use when you're applying eSTEM to patients, okay? So first and foremost, sometimes it matters, sometimes it doesn't, knowing the polarity. So an anode is the positive electrode, and the cathode is a negative electrode. I'll tell you later when it comes up, like sometimes you need to know that, whereas sometimes, it doesn't matter what the polarity is. But an anode is positive and a cathode is negative. Okay, a pulse, when a current is flowing. A phase is kind of like a pulse. It's impulsed current, right? It's a period when the current flows in one direction to when it stops and flows in the other direction. Just like what we just watched on that last slide. A burst. A burst is a series of pulses delivered all at once in a group. So you might have a burst of like 10 pulses, but they're all delivered together, like really rapidly, like right in a row. Frequency, the number of pulses per second. And so you'll see this when you are choosing some of the parameters when you're going to treat your patients. It'll ask you for how many pulses per second do you want. Sometimes it asks for hertz. Hertz and pulses per second are actually equivalent. So 50 hertz is the same as saying 50 pulses per second. And then some modalities, they only operate with bursts. Russian current, for example, uses bursts. So you might see bursts per second, BPS. Okay. The amplitude, when you're turning up the intensity of the electrical stimulation, it's the magnitude of the current. It's like how strong it feels. It's usually measured in volts or milliamps. It just depends on the machine you're looking at. A modulation. A lot of the machines have options for modulations, which the definition of a modulation just means the varying of any of the parameters. It just is like trying to make it unpredictable or random sometimes. It sometimes makes people feel comfortable, sometimes makes them relax. And the real purpose of it is to make sure that the person doesn't get used to the e-stim, especially for pain control. We don't want them to do what's called accommodation. So if this thing you stick on is supposed to be helping control your pain, but then your body sort of gets used to it and it no longer helps with pain, we don't want that to happen. So we do modulations to kind of give a variety of sensations to the body. Resistance, which also is referred to as impedance when we're talking about electricity, is opposition to the flow of electrical currents. Different tissues in your body oppose the flow of electrical current. So water is a really good conductor of electricity, right? There's a lot of water in muscle, but fat is less of a good conductor of electricity. So when you're putting on electrodes on someone, depends on the area that it's in as to if you're going to get any opposition to the flow of that current. All right, I'm going to talk to you a little bit more about waveforms. So we already talked about what an alternating current looks like, right? And here's your pulsed currents, the monophasic or the biphasic. There are even further breakdowns. And the reason I'm telling you about this is because this is what they're called on the e-stim machines. They'll refer to some of these options that you get to choose by the shape of the waveform. So you can have symmetrical alternating current, right, where what goes up and what comes down kind of matches. But you can also have asymmetrical current. Within asymmetrical current, you can have something that's balanced, which means that the amount of positive and the amount of negative that's going into the body is equal, and so therefore the end net charge that's going into the body is really zero. Like the positive and the negative cancel each other out. You can also have unbalanced asymmetrical alternating currents. That is going to leave a net charge in your body. Okay. Monophasic pulsed current, like we talked about up here. Biphasic pulsed current, like we talked about down here, right? It's going into the positive and the negative within that whole pulse goes into positive and negative. Whereas in monophasic, the pulse only is going into the positive. So in pulsed current, your biphasics can be symmetrical, like they are here. They can also be asymmetrical. And again, if they're balanced, they leave zero charge in your body because the positive and the negative cancel each other out. If they're unbalanced, they leave a net charge in your body. So for most of the time when you're working with an e-stim machine, you're going to see that the lead wires have red and black. And most of the time it doesn't matter because almost everything you're using is balanced. So there's really no true negative or positive. There's no true anode or cathode. So it doesn't really matter for the most part when you're putting on like tens or Russian current on somebody. It doesn't matter which one is black and which one is red. But there are sometimes that's going to matter, and so I'm going to tell you why here. All right, so here's some examples of what we just talked about on the last slide. So this is a symmetrical biphasic waveform, right? It's going into the positive and the negative, and those two little rectangles match, like the area of these rectangles is the same. That's symmetrical biphasic. Over here, this is an asymmetrical, right? Because it's obviously these are different shapes, so they're asymmetrical, but they're balanced. So the total area of this little semicircle and the total area of this little square are equal. So the net charge is zero because those are balanced. And it's biphasic, right? So you get all that. It's balanced, it's asymmetrical, it's biphasic. Down here, they're unbalanced, right? So we have biphasic. It's going up into the positive and down to the negative, so that's biphasic. It's asymmetrical because these little shapes do not match at all. And they're unbalanced. The area of this giant rectangle is much bigger than the area of this little semicircle. So that's going to leave a positive charge in the body because the positive is greater than the negative. Okay? So remember, biphasic alternates between positive and negative. Symmetry, the curves match in shape. And if they don't match in shape, they're asymmetrical. And then the balance, the areas under the curve are equal. And that means the net charge is zero, or they're unbalanced and they leave a charge in the body. So three currents that come up that you'll use sometimes that actually do leave a charge in the body where you really do have to know the positive and the negative electrodes are direct current. So, right, direct current's only in the positive and only in the negative. And so an example of where that's going to be important, where you know which one is which, is iontophoresis. Monophasic pulse current, which is used in wound care. You'll need to know which one's positive and which one's negative, and you're going to stick it on the wound depending on what you want to happen. And then asymmetrical unbalanced biphasic current is also used in wound care. So here, this is where the positive and the negative matter a lot. And don't get hung up on red and black. Right here I put positive as black and negative as red, but each machine, the manufacturers make things and they don't always make red positive and black negative or vice versa. So you really have to read the user manual for the machine you're using to figure out which one is the negative and which one is the positive for the current that you're going to use. All right. I promise I'll give you a break in just a second. Parameters. Parameters really are kind of like going to determine the purpose of your treatment. But the way you set them up, this is one of the machines that you will use in lab. And this is kind of what it says. This is the screen where you get to choose all your parameters. So the name of the waveform is a symmetrical biphasic. And I'll explain kind of what all of these are. So you know what the waveform is. That's the type of current you're using. The cycle time, which is right here. You can choose continuous, where it's just flowing on all the time. Or you might be able to set up where it has like certain periods, several seconds where it's on and then seconds where it's off. Frequency. Remember, it's like how many, how frequent. So how often are pulses going into the body? So it's the pulses per second, or hertz, right? So frequency here on this one is 35 hertz. Okay, a ramp up and a ramp down time. It's not on this particular example, but you don't want the current sometimes to just turn on and like really surprise someone. And so it'll gradually turn on. It'll ramp up to the intensity that you set. And then when it's going to turn off, it doesn't just cut off cold turkey, it ramps down. So the current increases from 0 to the amplitude that you set, and then it ramps down when it's turning off or in between current. Okay, the pulse or the phase duration, that's something you get to pick a lot of times on the parameters. Now, a lot of times you turn on the machine and it's preset because, there's kind of an ideal setting for pulse or phase duration when you're going to use, symmetrical biphasic in this example. So the pulse or the phase is when the current's flowing, and the duration of that, it really kind of dictates whether you're getting a sensory or a motor response. And so it can also increase the depth or give you a stronger contraction sometimes. So we're going to get into that and how to choose that. The amplitude is the intensity, or how strong it feels when you turn it up. And that's right here. And this one in particular is measured in milliamps. And then modulations are optional. On this particular screen here, there's a frequency modulation and there's an amplitude modulation if you wanted to do that. And it just gives the patient a variety of feelings. And then there's the treatment time. Depending on what you're doing, you will choose different amounts of time. And then you'll see this on some machines and not others. And I just want to clear it up so you don't panic when you see it. Just leave it on the preset. This thing, the CC/the CV, it stands for constant current or constant voltage. So you could switch it to whichever one you wanted. I would recommend just leaving it in the default one. It just basically, this is something that the machine can use to sense if it's getting any resistance or any impedance to the electrical current, and it will adjust the voltage accordingly. But I would not do that. I would just leave it on constant current so there's no surprises to your patient. You don't want the machine adjusting itself. You want to be in control. So just leave it on the default. All right. Time-dependent parameters. So ones that you're probably going to be able to pick and adjust. we talked about on the last slide, pulse duration and phase duration, usually measured in microseconds, and it'll have this funny little mu sign, microseconds. This is what it looks like, just so you kind of understand what these things are. So remember, you've got your pulse, right? You've got your part of a pulse, which is a phase, right? It's the phase, it's part of the pulse that's in the positive, and then the next phase is part of the pulse that's in the negative. So this whole thing, this whole red line is a pulse, and it's got two phases, biphasic, right? Positive and negative. And then how long is the whole thing lasting? And that's what you'll get to choose sometimes, and that will dictate motor or sensory, right? And then there's an interpulse interval, just means the time between when the pulses are delivered. I don't think you get to choose that a lot of times on the machines, but it's something that you kind of should know is happening in the background. Frequency. Remember, frequency is how many pulses per second are coming. And so here's an example of like the two different frequencies, right? So 3 pulses per second. So in 1 second, you're going to get a dit, 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 right? That's what you're going to feel. These little pokes is what it's going to kind of feel like. As you increase the frequency, those things start feeling like you're getting more of them in a shorter period of time. It feels a little smoother. So it's like, dit, 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 dit. You like my sound effects, I'm sure. So we'll play with frequency. You'll get to feel the difference when you adjust the frequency and how it feels to the person that it's on. On time and off time, you just get to choose this. It's probably most common when you're doing NMES for muscle contractions. So it's usually written this way. It'll be like a 10:50, or it might be a 10/50. It means it's on for 10 seconds and off for 50 seconds. And then ramp time, like we talked about, kind of smoothly going up and then smoothly going down, so it doesn't surprise people. It's typically preset 2 to 5 seconds. I would say 2 seconds is the usual that you want to choose for that. And the timing, all these things are important because the timing, especially the pulse and phase duration, it really dictates the purpose of your treatment a lot of times. Here are some examples of modulations. Like I said, it's varying any of the parameters. So you can vary a lot of things. And it helps limit adaptation or accommodation to the E-stim. We don't want that person's body getting too accustomed to this because then it won't help them anymore in terms of pain relief. So here's an example of amplitude modulation. Remember, amplitude is like how strong it feels when it's on you. So the intensity turns up, right? It starts out low and then it's gradually getting really strong and then it's coming down again and it's going up and it's getting really strong and then it's kind of backing off again. So that's what it would feel like. It would get stronger and less strong. Frequency modulation is these things start out, they're all the same amplitude, right? So they're all going to feel the same strength because they're all even at the top there, but they're coming in at different times, right? So there's a dit, 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 dit. I know, again, my sound effects, I'm sure, are helpful, but that's so it's coming in, that's the frequency modulation, right? You're changing what the person feels or how often they feel those pulses. Duration, so pulse or phase duration. So again, it's the same amplitude here, but they stay on longer. So the pulse duration is lasting longer. So it's beep, really fast, beep, getting a little longer, beep, getting a little longer, beep, a little longer, and then it kind of goes back down. So those are just some examples of things you can modulate and you'll play with it. You need to put these on yourself in the labs and feel it, and you'll go, oh, okay, I get it. Something that's kind of specific to just IFC or interferential current you'll see on the machines is you can set it to scan or sweep. And what you're doing is you're modifying the amplitude when you choose scan modulation, and when you choose sweep, you're modulating the frequency, as demonstrated down here with my awesome sound effects. Here's an example of what the ramp up time is, right? So the intensity is low and then it eventually gets high and then it's on and then it kind of like phases down again. This is an example of what a burst is. So all these pulses are kind of delivered really rapidly all at once, and then there's a little break. So it almost feels like one giant pulse, or a series of a bunch of tiny little pulses, but all together. So that's what a burst kind of looks like in visual representation. And again, you should put this on in lab and feel it, and you will. You'll get to feel all this stuff. Okay, in general, I kept saying it, right? The way you set the pulse duration or the phase duration really matters for sensory and motor. So in general, you have lower amplitudes and shorter pulse duration. It's usually for sensory reasons, so you're helping someone with their pain. Higher amplitudes and longer pulses are usually for motor, so you're trying to get a muscle contraction. All right, take a break and then come back. Take like a 2-minute break. Stand up, stretch, look out the window, but go away from the PowerPoint for a couple minutes. Okay, you're back from the break. Still talking about electrotherapy. Hang in there. All right, so remember the 3 major reasons you use all these different types of e-stim: for pain, for tissue healing, muscle contraction. So now what I'm going to do is kind of break down some of the specific types of e-stim for those different reasons. So we're going to start with muscle contraction. So there's a bunch of different types. An e-stim for muscle contraction is called neuromuscular electrical stimulation, or NMES. So this is how you'll find it in the research. Sometimes they research very specific protocols like Russian, but NMES is kind of the general term when you're trying to do e-stim for muscle contraction. This type of e-stim for muscle contraction is for people with intact peripheral motor nerves. Otherwise, it won't work. You'll have to use a different type. Russian protocol is kind of the most prevalent, most common one. On the machines that you use, you'll see something called VMS burst. And that's really just specific to that one company. They just created their own protocol for this reason. You can also use symmetrical biphasic for NMES. And there's also something called functional electrical stimulation. And I'll kind of tell you about all of them. So all of these currents are used to evoke muscle contractions, and they're typically pulsed. The frequency has to be high enough to cause a smooth contraction. Otherwise, it's really uncomfortable. And so the more, the higher your pulses per second or higher your hertz, kind of the more smooth it feels. If it's little pulses per second, like a small number of pulses per second or a small number of hertz, it's very jabby. So you need a high frequency in these to get a smooth contraction. And the electrodes need to be placed on motor points. Now, everybody's anatomy is a little different. We sort of know in general where motor points should be. There's actually a very nice couple of illustrations in your Kindle textbook, like the manual muscle testing textbook. So you can look them up in those books. But a lot of times when you put the electrodes on somebody and you're not getting a good contraction, it's because you're not near the motor point. They tend to be kind of near the musculotendinous junction of all muscles. And you might have to move the electrode around to get a better contraction. Russian protocol. Russian, yes, it is it sounds scary to people when they see it and they laugh, but it was developed by a Russian scientist. So it was specifically developed for quadriceps strengthening in Russian Olympic athletes a long time ago. I think it was in the 60s or 70s. This is used for innervated muscle, right? Have to be intact. And you get this pulsed alternating currents delivered in bursts. So on the machine, you'll see it's measured in burst frequency, or BPS, bursts per second. And that determines how strong the contraction feels. It's very common. You'll use it in outpatient orthopedic settings. It's very common after surgery, especially to the knee. So we use it on the quads a lot after any knee surgery. And it can be used for muscle activation. Let's say somebody after surgery, they can't really figure out how to contract their muscle. So we use this to kind of re-educate it. So neuromuscular re-education. It might be used to assist in strengthening. You might use it to assist in someone's endurance, but you can also use it to help help people gain range of motion. If they've lax range of motion, you can kind of contract the muscle to help them move through a range of motion. And you can also use it to kind of create some muscle pumping to get edema out. It is typically uncomfortable. And you will figure out how to word this to your patient. Like, this isn't going to feel good. If any of you have had it, you know it's very strong. You have to turn it up really. The amplitude has to be pretty high in order to really get a contraction. But it's not damaging anything, even though it feels kind of uncomfortable or feels very, I don't want to say shocking, surprising to people. But you got to tell them that ahead of time, right? But you're trying to turn it up pretty high so you can get a visible contraction. There's a very specific protocol. You turn the machine on and you can pick and choose a few things, but you don't have to change many of the parameters because they're already set. And then it's very important that you use, there's different on-off time settings. So an example might be 10 seconds on, 10 seconds off. But depending on the purpose of your treatment, whether you're doing muscle activation or strengthening, range of motion, this will vary. And so you're going to have to figure that out. What's the best on-off time? Functional electrical stimulation. This is for patients with neurological disorders, but they have an intact peripheral nervous system. So very common in people who've had strokes. It might be actually also used for people with spinal cord injuries. It just depends on the severity of the spinal cord injury and if they have any peripheral nerve. A lot of times their peripheral nervous system is fine. It just kind of depends on where their injury occurred. And it can be used for lots of different reasons. So it does help increase strength in muscles that you put it on. It can help prevent atrophy. It can improve motor control, kind of help someone understand when they're supposed to contract their muscle if they don't have good timing. And a secondary effect, so I made you watch this, that cool video, the rowing video that's on D2L. Hopefully you've watched that. That's a very good example of functional e-stim being put to good use. So it can kind of have this secondary effect of if you can get people moving more so with a little help from the e-stim, it also might improve their cardiovascular health, right? So the brain says, I can't believe how long it's been since we've exercised. Y'all ready to pick up where we left off? And the lungs and the heart are like, listen. And the muscle's like, hey, we forgot how to exercise. So, kind of all works together. The big thing with functional electrical stimulation, it's very similar to like the Russian protocol, but you are using it at the same time you're doing a functional activity. So a really commonly used FES is you stick the e-stim on the tibialis anterior muscle and you're trying to stimulate it so you get ankle dorsiflexion during walking, and you time it, with when you want somebody to dorsiflex. So this is used with people who have foot drop a lot of times. There's something called electrical muscle stimulation that we are not going to do. It uses a direct current, and it is for denervated muscles. So somebody has their peripheral nerve is no longer attached or does not have connection to their muscle, right? Does not turn on that muscle anymore. So it can happen with cauda equina syndrome, or if you had a peripheral nerve injury. So for instance, like a crush injury, or maybe something got severed, like the limb didn't get amputated, but a nerve maybe got cut and they weren't able to reconnect it. So that muscle no longer has innervation. So you stimulate it with this electrical current, and it may prevent atrophy, or it may prevent fibrosis of the muscle. It might increase blood flow to that muscle, but you have to use it all the time, right? If those results are actually going to be meaningful. All right, e-stim for pain. So those are all the ones for muscle contraction. Now we're moving into different types of electrical stimulation that you would use to control pain. All right, so they're typically alternating or pulsed, all of them. So you've got something called interferential current, which will be labeled as IFC on your machines, premodulated current, or premod, transcutaneous electrical nerve stimulation, also called TENS, very common. And within, on the machines that we have in our lab, symmetrical biphasic and asymmetrical biphasic are really kind of fall under the TENS. They're very similar setup to TENS, or those are your options. If you wanted to do TENS on someone, you could use either one of these waveforms. E-stim for pain, when you set up the parameters, it largely just depends on the patient preference and comfort. It just needs to make them feel good, and that's different for a lot of different individuals. So you really can't go wrong, honestly. You just set it up, and if they like it, it makes their pain feel better, your job is done. And there are a couple different theories as to, well, how does the electrical current make people feel better? Like, how does it actually control their pain? So there's something called the gate control theory, which you guys may have learned. I don't know if you've heard about this yet, but I'm going to explain it. And then there's also something called the endogenous opioid theory. So you've got like 5 major things that you can feel, right? So your sensation is made up of all the things basically that you feel fall into all these categories. You can feel pressure, you can feel vibration, you can feel light touch, you can feel temperature, and you can feel pain. So everything falls into one of those categories. Now, those first 4, like all of them except for pain, the reason you feel these is that they use large diameter nerve fibers. They're called A beta fibers. Just remember that they're just larger diameter nerve fibers, and they go up to the brain faster. Nociceptors, which are little pain sensors, and they each within pain, they can tell if it's mechanical or thermal or chemical pain, right? These all use smaller diameter nerve fibers. So they're a little smaller and they're a little slower. So e-stim for pain, when you turn the e-stim on, you activate these larger diameter nerve fibers, and you kind of override the pain. And that's how the gate theory works. So here's a visual. So your brain's here. You're about to send a signal, right? Your hand is touching, let's say, a hot coffee cup. You go to grab a cup and you didn't know it was hot. Well, the brain only has one track to it, right? So you can either, the pain can get through the gate and go up there, or any other sensation can go through the gate and get up there, but they both can't go at the same time. So you put your hand on there, and depending on how hot it is, right? If it's not that hot, you'll recognize that it's warm. You'll go, oh, okay, go through. The gate, lets that sensation of warmth go through, but it's not dangerous. You go, oh, okay, it's not bad. You touch that hot cup, you go, wait a second, that's really hot. That hurts. It's because these guys got through, right? And they told the brain that's too hot. So I like to give my patients, I give them this talk actually when I explain why does the e-stim work, or how is it going to work. I say, well, you can feel these 5 things, right? So you can feel pressure, touch, vibration, temperature, and pain. And like all those other sensations can override the pain. And like, for example, when you whack your head on a sharp corner, right? And I gave this example in the last PowerPoint. You whack your head on a sharp corner and it hurts, right? Oh, we've all done that. It's like, oh, you get so mad and like it hurts, and you rub it. You immediately reach up there and you rub it. Well, guess what you're doing? Touch, vibration, pressure. It overrides the pain. Same thing if you've ever hit your thumb, like you're hammering in a nail to a board, right? You're hammering, and you accidentally hit your thumb instead of your nail. And it hurts. And a lot of people will immediately put their thumb in their mouth. They go, oh, they put their thumb in their mouth, and guess what sensations you get? You get, on that painful thumb, you just put it in your mouth and you got a new temperature, light touch, right? You're overriding the pain with something else. So that's what e-stim does. So it gives a different sensation in that area. It gives a vibration or a light touching sensation, and it overrides the pain. So that's the gate control theory, and that's how TENS typically works. The endogenous opiate system, so the endogenous opiate theory, is another theory as to why e-stim might reduce pain. So your body has natural opiates in them, opioids, right? I know we all talk about like opioids are terrible drugs, but you do have them in your body for controlling pain naturally. And they are morphine-like substances in your blood and your cerebrospinal fluid, and they can block or diminish pain. So E-stim can trigger preferential and larger activation of those pain fibers. This is certain types of E-stim can trigger, like basically can irritate an area on purpose, and trigger the pain and increase it temporarily. So your body will naturally like kind of kick into savior mode, and it'll release endogenous opiates in that area. So this one, there's something called acupuncture-like TENS, that, and it's called that because it is kind of equated to feeling like somebody's poking you with a needle. And same thing with acupuncture. When you poke a needle in there, it's possible, it's a theory, right? We don't know, that this is why it makes people feel better, because it allows your body to naturally release those endogenous opiates. I was always, there's also another way to explain it, where if you've ever had a runner's high, I don't know if any of you are runners, but a runner's high is like you're running down the road and you kind of hit your stride and you just feel like you could run forever. And it's because your body is in this state where it starts releasing these nice opiates and morphine-like substances, and you don't feel any pain and you feel good and you just feel like you could go and go and go. So the E-stim, especially E-stim for pain like TENS or whatever, if you turn it up high enough where it gives you just a teeny tiny bit of small muscle contraction, is also thought to release some of these endogenous opiates, just like when people get a runner's high. So that exercise or that muscle contraction is helping release those opiates. So those are the two reasons, the gate theory and then the endogenous opiate system. All right, now here are the types, like we talked about them a second ago, but these are the types of E-stim for pain. So one of them is interferential current. And the reason it's called interferential is because it's talking about two alternating currents that are on your body, and they're crisscrossing, so they're interfering with each other. So the way you put it on, interferential is very unique. The way you apply it to someone is always like in this X-like formation. So you have to have 4 electrodes, and those 2 channels, right? You have to have 2 electrodes per channel, right? So channel 1 up here, you put electrode here, and it's talking to its buddy, this other electrode over here, channel 1, they're talking to each other back and forth. That current's going back and forth between those electrodes. You put channel 2 here, they're talking back and forth, and the interference of channel 1 and channel 2 right there is how interferential works. So they will interfere with each other, and they produce groups of pulses called beats. And so you'll see on the machines that you can help choose the beat frequency. And really what that is just the difference between the 2 frequencies of the channels. So if you see here, channel 2 is 5100 hertz, channel 1 is 5000 hertz. And this is the difference, is 100, right? So that's what your beat frequency is. That original frequency up here, like the 5100 and 5000, those are called carrier frequencies. So on the machines, you get to choose all these. What's the carrier frequency? And that'll kind of determine the beat frequency. Premod, or premodulated current, is an alternating current. Sequentially increases and decreases amplitude. It kind of feels like it's kind of phasing up and down. And it is 2 electrodes, 1 channel. Now you can set up more than 1 channel of premod on somebody, but they're not talking to each other like they were. They're not crisscrossing like they were in interferential. So I want to make that point. See how this one is like in an X? Channel 2, channel 1. In premod, they are not talking to each other. So this is like channel 1. And over here, totally independent of channel 1 is channel 2, just going up and down. All right, TENS. So there's 3 types of TENS. There's conventional TENS, which kind of works on the gate theory. Low rate or acupuncture-like TENS, which kind of works on the opiate theory. And then something called burst mode, which is kind of similar to acupuncture, like where groups of pulses are delivered together. It really probably feels very similar to acupuncture. So it's just, again, patient preference. But both of those, they're a little bit like more jabby. And so they're working on that opiate theory, like you're sort of irritating that area on purpose and it releases opiates to calm it down. All right, now we're moving into the third kind of major category of why you use e-stim, right? We did e-stim for muscle contraction. We did e-stim for pain. Now we're going to look at different types of electrical stimulation to promote tissue healing. So there's three kind of major categories within tissue healing. So you can use e-stim for transdermal drug delivery. And what that means is just like across the skin, right? It's like an alternative to getting a shot with a needle, right? So we use iontophoresis for delivering drugs through the skin using an electrical current. You can use e-stim for wound care to promote wound healing. We are going to do high volt pulsed current. We are not going to do microcurrent, but that is an option on one of your machines. But the HVPC, very common for wound care. And in general, when you're using high volt pulse current, this is one of those where it matters that you know the positive and the negative. Actually, for all of these, it matters. The positive and the negative electrode really matter for all of these things that promote tissue healing. So in general, you'd stick the negative electrode in the wound or right next to the wound if it was inflamed or infected. But if it wasn't inflamed or infected and it's just a wound that's clean, but it's healing and you want to kind of push it along to heal faster, you would put the positive electrode either in the wound or near it. And then you can also use e-stim for getting rid of edema. So high volt pulse current can be used for that as well. And that is, again, you need to know the positive or the negative electrode, where you would put it. Some of you will do a project where you tell us the answer to that question. And then you can also use one of the NMES types of, muscle contraction types of e-stim to help create a muscle pump to get rid of the edema. So pulsed biphasic, symmetrical biphasic, or Russian. All right, so here's some of the details about ionto or iontophoresis. Remember, it uses a direct current. So it turns on, it just stays positive or negative. So we're going to use that electrical current to deliver a liquid medication that has ions in it. We're taking you back to chemistry. They're electrically charged, so they're either positive or negative ions. It depends on the medication as to, so you have a positive or a negative charged drug, and you hook it up to the iontophoresis. So if you have a negative drug, the liquid medication has negative charge in it, we stick the negative electrode on it because we're trying to repel it, basically. That current's going to go down to that medicine, and that medicine is not going to like that, right? Like charges repel each other. Remember, opposites attract and likes repel. So that negatively charged medicine is going to be getting a negative charge going towards it, so that medicine's going to run the other way into your skin. The parameters for ionto are a little bit unique. You do something with amplitude and dosage, and they are interconnected. And they the way you set it up kind of dictates patient comfort. And this isn't supposed to feel uncomfortable. You're not doing this it's not like e-stim for pain where your patient's comfort matters, but you do want to be careful about making it comfortable because it can leave a burn if it's not comfortable. So it's, the parameters of amplitude and dosage and total treatment time are kind of all interconnected, and it's written down as milliamps per minute. Someone will teach us about that, one of your group presentations. This does have a risk of skin irritation or burning, so you got to be careful in how you apply it. There is a table in your textbook. In the 4th edition of the Cameron textbook, it's table 14.4. Yeah, I'm not sure what it is in the 5th edition, but It's easy to find, where they have a table of all the different liquid medications that you can use with Iadto and what their charge is and what they would be used for. Probably the most common one we use in physical therapy is dexamethasone, which is a negative medicine. And there's different ways you can apply this. So in the clinic, you can have like a device where they just have to sit there and it delivers the charge and delivers the medicine. And then there's something called a hybrid device where you stick this thing on, almost looks like a Band-Aid. There's a positive and a negative side where you put the medicine, depending on what its charge is. And then you stick this little battery operated thing to that electrode, just for like a couple minutes, like 2 minutes. And then it basically charges it up. And then you take this little device off and then the patient can leave the clinic. And then they're like fully disposable where you put the medicine on. See, they all have like a positive and negative side. You stick the medicine on depending on what you want. And then you put it on the area that you want treated, and the patient can just leave. And you tell them to wear it for so many hours, and then they leave. They take it off at home. All right, high volt pulsed current. This is what it looks like. It goes up to high voltage. It's delivered in 2 little pulses there, the example, and then there's a big break. Right, the definition of pulsed current. So it's ultra short phase duration, super short, very high amplitude. The goal is to depolarize sensory and motor nerve fibers and not really stimulate any nociceptive fibers. It's monophasic, and remember the positive or the negative matters depending on what the purpose of what you're doing is. And it's most often used in wound healing and for edema. So with wound healing, you can stick these electrodes like right into the wound. We are not going to do that in our lab, but just know you could. But you can use it for edema, and we will practice using it for that reason. Later, when you get in your integumentary class, you might do this where you stick it directly in wounds. All right, microcurrent is, I want to just tell you about it. It's like a type of current that you can be used for wound healing. It is an option on one of the machines we have in the lab. It's very low amplitude, like you can barely even feel it, if at all. Used for wound healing, but we're not really going to practice it, but I just want you to be aware of what it is when you see it on the machine. All right, why would you use e-stim? Well, we talked about it today in broad categories, right? Muscle contraction, pain, and tissue healing. But here's some more specific reasons. So you want to relax a muscle spasm. You want to prevent atrophy. You want to increase local circulation. You want muscle to get stronger. You want to re-educate a muscle. You want to facilitate wound healing. You want to resolve edema or the inflammatory process. You want to stimulate the calf muscles to prevent DVTs from forming. You want to maintain or increase joint motion. So you want to get the e-stim to kind of help that person move. You want to control pain, or you want to deliver drugs for different reasons. And like I said, the most common reason is with dexamethasone. When we deliver that drug, it's usually for like tendinopathies. All right, now I talked about a little bit like what are contraindications and what are precautions. So here's some pretty common contraindications for e-stim. If someone has a pacemaker, we don't put electrical devices on them because we don't want to interfere at all and change how the pacemaker is working. Or if somebody has an unstable arrhythmia. You don't want to put e-stim in an area of thrombosis or thrombophlebitis because e-stim can increase circulation. So if they're having like a bleeding problem in that area, we don't, like with hemorrhagic, and then also with clots, we don't want to put it around that area to dislodge the clot or to increase a hemorrhage, right? We don't put electrodes over the carotid sinus, which is kind of on the anterior lateral neck. Your vagus nerve is there. We don't want to stimulate the vagus nerve because it has a lot to do with heart rate and other things, and so we don't want to really mess with that autonomic nervous system. Pregnancy, you got to be careful. It's not that you can't use it on pregnant women at all. You just can't do it around the fetus. So you can't do it on the abdomen, or on the trunk, or the low back, anywhere that it might affect the baby. If somebody, it says here you shouldn't put it on an active infection. Now, if that would not be true if you were actually treating it, treating a wound. Of course, that's okay. But if you were doing like TENS, you wouldn't want to put that over an infected area. You don't put electrodes and turn on the e-stim on your eyeballs. I think you guys would probably use common sense and know that. And you shouldn't use it for pain relief unless you know why that person is having pain. So you don't do it on undiagnosed conditions or pain. Precautions, just be careful. People have cardiac diseases because you are changing circulation. And if somebody has some sort of reason where their heart can't keep up with this new increased circulation, you need to be aware of that. So it's precaution. Doesn't mean all people with cardiac disease. It just means certain people. You need to know some more detail about their cardiac disease, right? People who have impaired cognition or impaired sensation, not contraindicated, but you need to be careful, right? You need to check on them more often, or make a judgment based on how they are, if you think this is good for them. You don't put e-stim over malignant tumors. We don't want to, most of the time, we don't want to try to make it grow. We don't know if e-stim will stimulate the tumor, so we kind of are careful about that. Not contraindicated, but you're careful. You need to know more details about that tumor and about their cancer. You don't put it on areas of skin irritation or open wounds. That is, of course, unless you're treating a wound with the e-stim. But again, like you wouldn't do you wouldn't do Russian stimulation. Like you wouldn't put the electrodes over the incision if they just had knee surgery or something like that. Be careful about like thick adipose tissue. So if somebody has a lot of adipose tissue, remember that's more impedance. So the e-stim might not work the way you want it to in that area. So you got to consider that. If you're doing iontophoresis and delivering a drug, you got to be cautious about whether or not you decide to combine that with another physical agent, such as a hot pack or a cold pack. For instance, you put ionto on somebody because they have tendonitis, but you also think they need an ice pack at the same time. But then the ice pack makes them numb and they can't feel anything, and they're getting a skin burn from the ionto, right? So you got to be kind of careful about how you choose to do that. And then be careful about producing muscle contraction. So anytime you wouldn't want to produce a muscle contraction voluntarily, you also wouldn't want to do it with e-stim. So if somebody has a fracture and they're immobilized, we're not going to try to turn on e-stim for muscle contraction and have that muscle pull on that bone that's not healed, right? So you need to be careful about that. Something just to consider, you are working with electrical devices, so be careful with them. Always tell the patient why you want to use it, inform them, educate them on it, and then always obtain consent before you use it. Obviously avoid water with your e-stim machines. Don't be wet while you're handling it. Don't put it near water. If you are using a battery operated device, like a portable one, they always tell you don't have one of those on while you're operating a vehicle. Just because you don't want to be surprised and crash your car if something were to malfunction with the device. Always make sure you have looked at the operating manual. In our lab and also on D2L, I have put all the user manuals for all the machines. And you will have to look through them sometimes just to be certain or just to get some clarity. So you'll have to do that in the clinic and in real life too. And then make sure you are always starting the amplitude out at 0 before you ever apply electrodes, or you will shock yourself or surprise your patient. So just make sure everything is set at 0 before you start applying it. Never adjust the amplitude. If you have something that's going in an on-off cycle, you don't try to turn up the amplitude when it's in the off phase, or you will surprise and get a patient angry at you. And then always use the power switch to turn the unit off. Don't just unplug it from the wall while it's on. And then always increase the amplitude gradually when you do turn the unit on. All right, go and take another break. We're almost done, but get up and stretch a little. Okay, we're just going to talk a little bit about the units themselves and about the hardware and some other stuff. Okay, so these are the names of everything I've been talking about, right? When we're talking about a stimulator, you're talking about the machine. It'll be called the stimulator or the unit or the machine. The lead wires, right, are each one of these is a channel or a lead. And actually, that's a channel. You see that, and they all have two leads. So each one of these is a lead. So that's where you connect the electrodes to the lead wire right there. A coupling media, which is a substance that reduces, impedance from the electrode to the skin. Our electrodes have this like gel stuff on them that's what that is. It kind of comes automatically with a coupling media, but there are electrodes where you might have to put a little ultrasound gel on it or something to use as a coupling media. And then these are the electrodes. You guys will all get these. You get your own little pack. And then there's a safety switch often with a lot of units. So you set somebody up, you set your patient up on it, and you can go and do something else, and they have the ability to turn it off in case something goes wrong or they're uncomfortable. So coupling media is a substance that serves to decrease impedance between the electrode and the skin. So depending on what type of e-stim you're using, like if you're doing wound care, you can use disposable sponges or gauze that are soaked in like saline solution. You can use gel such as ultrasound gel, and the electrode itself might have a coupling media like in the adhesive, and that's what yours have. There's also, you can use straps to strap them on, or pre-wrap or tape to kind of also make sure that the electrode is really stuck down on the skin. There's no resistance. Different types of electrodes. So there are surface electrodes, which is what are kind of the most common. Tons of different shapes and sizes. And when you do put them on, you need to document what size and shape you used on your patient. Iontophoresis electrodes are very unique, and they have like a little reservoir. It really looks like a little cotton pad that you put the liquid medication on. You can have handheld probes. These are probably more common for like the denervated muscle stimulation. So you can stimulate small muscles, acupuncture points, but you can also do something called combination therapy, where you use ultrasound and electrical stimulation at the same time, and your ultrasound head becomes one of your electrodes. So you have one electrode and the ultrasound head, and we'll play with it. I'll let you guys play with it, see what it feels like. And then they are for pelvic floor therapy. They're intravaginal and intrarectal probes to stimulate the muscles of the pelvic floor. So here's some pictures of all of them. So these up here are the common ones that you'll see in the clinic, and that we're using these little square ones. We also have some of these rectangle ones in the lab. These big ones are non-disposable. This is what everybody used to use, and you have to have a coupling media with these, and you also have to strap them to the patient. They don't have any adhesive on them. These are different shaped iontophoresis ones. So when you flip these over, you'll see this little cotton pad under these raised areas that holds the medication. Here's an example of a handheld probe. Here's an example of a garment electrode. So on the hand and the foot, where it might be tough to stick electrodes, like on your fingers and toes, they do have garments. And then here's examples of the pelvic floor e-stim electrodes. All right. So taking care of your electrodes is important to make them last. So they have some sort of conductive material on them, right? That serves as an interface between the e-stim unit, the stimulator, and the patient. They're made lots of different materials, and they might be reusable. They might be just for one patient and you can throw them away. Those are the kinds that you guys have, but they also might be reusable and be able to use on multiple patients, such as those like carbon ones. Let me go back one slide. These carbon ones are able to be reused on lots of different people and cleaned, versus these you should only use on one person, and then once you use it a few times, you throw them away. Over time, all of them are going to deteriorate and it must be replaced. So they'll last longer if you care for them properly. So I will get on you about taking care of your electrodes so they last the whole semester. If they don't stick, they don't provide uniform current flow, and you can get hot spots. So you really want to make sure that they are sticking, and I can show you some tricks, or you can learn some tricks in lab if they're not sticking well, how to make them stick. Okay. The reusable kind, the big rubber carbon electrodes, they can be replaced about every 6 months, and then the little disposable ones after 2 to 15 applications. We are going to break that rule for you, and as long as you're the only one using your electrodes, it'll be fine. Just know this. So there's something called current density. So the amount of current per area is what that is. So basically, the smaller the electrode, so current density is inversely proportional to the electrode contact area, which means smaller electrodes hurt and bigger electrodes feel more comfortable. So the bigger the contact area, the nicer it will feel on people. So you want to make sure you have good contact with your electrode. You want to avoid putting it over bony prominences. You won't have good contact. It also hurts when it's on bone. Try putting it over like your scapula, something really like a bone really close to the surface. It doesn't feel good. You want it to be on a more meaty area. And then the distance apart electrodes are, they always need to be at least 1 inch apart, no matter what. But you can put them further apart than that. And the further apart they go, ends up getting a little more depth of the current. So depending on what you want to do with your patient, you might put them further or closer together. Okay. So when you're placing them on, you always have to have 2 electrodes to complete a circuit. So if you're doing East inframuscle contraction, you need to put the electrodes on motor points in that muscle. Again, you can see motor points of the upper and lower extremity on the in the Kendall textbook. And you put them at least 1 inch apart. For pain control, you just put them on around, sometimes proximal to the pain, but just kind of in that area. And then for tissue healing, remember when I told you the polarity matters, so knowing the positive and the negative electrode is going to matter for tissue healing. The active electrode, whether it's positive or negative, the one that is doing what you want it to do, the one that's kind of fulfilling the treatment, putting the active electrode in or around the target tissue, whether you stick it like in the wound or on the tendon you're treating with Ionto, you'll put it on, that's where the active electrode will go. So like the one with the medicine in iontophoresis that goes on the tendon that you're treating. And then the other electrode becomes what's called the dispersive electrode. So it's usually larger than the active electrode in Ionto, but it might not be. And then you just put it somewhere on nice intact skin, away from the wound or right away from the tendinopathy or whatever you're treating, and just put it several inches away. So this one needs to go more than 1 inch away, and it's usually proximal. All right, preparing your patient. You always have to cover like in your own head and also talking to them. You gotta ask them some questions to make sure there are no precautions or contraindications, right? Then you gain consent. It's okay if I use this on you. And you need to tell them why you think it's going to be good for them and what they should expect. Then you're going to look at their skin. You want to take note of how did their skin look before the treatment, because it might look different after the treatment, and you need to make sure that there is, if there is a difference, you need to make sure, well, what did it look like before? So you look at it, and you document it. Then you clean the area that you're going to put the electrodes on. Now, in our lab and in tons of clinics, people use alcohol wipes to clean the skin before they put on electrodes. And, I will say it's good in that it makes the electrodes last longer because it cleans the oils off the skin. And so those electrodes don't get oily, and therefore they stick longer. However, Dr. Barrett will tell you, because she's an expert on skin and a wound care specialist, that cleaning the skin with alcohol, actually, it strips your skin of some natural protective things. It can actually cause skin irritation. So in an ideal world, you would clean your patient's skin with soap and water, or even just water, before you stuck the electrode on them. Most of the time it's not a problem. You can use an alcohol wipe, but ideally you'd be able to do it with soap and water. If they're very hairy, electrodes won't stick to them, so you might have to shave some hair away. I've done that many times in the clinic. Always remove any jewelry around that area, especially you're doing e-stim around someone's neck or upper back and they have a necklace on, it needs to be removed. And then you position them in some position of comfort that they're going to be able to lay or sit in this position for 10 or 20 minutes comfortably. You might be applying something else at the same time, such as ice or a hot pack. Just beware if they're sitting or lying on something. If you set it up on their low back, the e-stim, and then they lay down on it, you can really increase the intensity. So if you set it up while they're sitting and you turn it on and they go, yeah, that feels good. And then when they lay down, you actually the weight of their body on the electrodes will increase the intensity. So you may, be careful about, maybe I would suggest always putting them in the full position they're going to be in and then start turning on the e-stim. You might need straps to hold electrodes on. And you always give your patient the safety bell or a switch so they can alert you or turn off the unit themselves safely if something is not feeling right. And then finally, documentation. So you always document the area you treated, the position the patient was in. If you have more than one e-stim unit, you need to say which one you used. You need to say what type of electrodes you used, especially the size of them is going to matter, and where you put them on the patient's body. And then you write down all your parameters. Oh, there's so many parameters. So what type of e-stim did you use, right? What's the waveform? Did you use TENS? Did you use Russian? Whatever. If a polarity matters, like if you're using high volt, did you use negative or positive on the affected area? What was the pulse duration? What was the frequency? Did you use an on-off time? May or may not be applicable. Did you use a ramp up or ramp down time? Did you use any modulations? And then what was the total treatment time? One thing that you really don't need to document is how high you turned up the strength of the current, the amplitude. It just varies a ton. It's never going to be the same, even on the same person. So I don't think you need to document that. If you really had to turn it up really high before the person responded, maybe I would note that, but I don't think I would write the actual number. Just remember that when you write down all of your parameters and everything in your documentation, it needs to be reproducible. Could your coworker come behind you tomorrow and set this up the same way that you did? And always need to document how the patient responded. Did their skin look like this afterwards? Or did they respond well? Did their pain go down? Did their motion improve? Whatever. Something objective. Was there any change? All right. That is it for electrotherapy. I know it was a lot. Tried to get it in just around an hour, and we did. So I know you'll probably have questions, and you are going to have lab on this the following week after listening to this. So, get ready. Come into lab, and you're gonna get into this. You're gonna need your textbook. You might need your notes from this PowerPoint, but definitely your book is going to be helpful. And I'll see you then.